Hello, everyone. My name is Sophia Gutierrez, a psychology major at the University of Arizona Global Campus. Today, I would like to present to you the effectiveness of integrating religion and spiritual beliefs in cognitive behavioral therapy in patients with major depressive disorder. Every human has emotions. Many ups and downs in life are inevitable. However, major depression disorder, also referred to as MDD for short, is a mood disorder that has many symptoms which can be debilitating. Depression is a significant public health problem and is one of the major causes of disability worldwide. Approximately 10% of people will experience depression in their lifetime. Major depressive disorder is characterized by discrete episodes of at least 2 weeks duration, although most episodes last considerably longer, involving clear-cut changes in affect cognition and neurovegetative functions and inter-episode remissions, having the ability to affect every area of a person's life. Without help, this disorder can become persistent and associated with higher rates of mortality, with the risk being up to twice that of the general population. Those who are experiencing depression must seek treatment. Hope and freedom are possible. Intervention studies have found that when working with religious clients, incorporating their religion or spirituality is as effective, if not more so, effective in reducing depression. One of the most evidence-based forms of psychotherapy is cognitive behavioral therapy, CBT for short. However, there's little information available that provides a manual or developed treatment plan that integrates religious spirituality in psychotherapy. This presentation seeks to show the commonalities in religious spiritual approaches and cognitive behavioral therapy to represent its potential effectiveness in integration. A brief overview of cognitive behavioral therapy was developed by Aaron T. Beck in the 1960s. He was recognized as the forefather of cognitive behavioral therapy. CBT is a psychotherapeutic approach that helps individuals identify, challenge, and change cognitive processes that drive a person into an emotional state of depression. The central premise of CBT is that thought patterns and beliefs, emotional states, and behavior are all interconnected. Let me show you how religion can integrate with cognitive behavioral therapy. Those who are depressed have a greater tendency to engage in cognitive errors, such as jumping to conclusions, using a negative mental filter, an all or nothing type of thinking, or catastrophizing. CBT teaches individuals to identify, challenge, and replace distorted thinking styles with healthy thoughts and behaviors. This can be done by psychotherapy that includes questioning, guided discovery, homework, and focus on the difficulties currently manifesting. Many religions, such as Christianity, Islam, Buddhism, and Hinduism, for a few examples, teach similar principles. Integrating the two can be a powerful tool to use the client's traditions as a foundation and guide to identify and replace unhelpful thoughts and behaviors to reduce depressive symptoms. Let me name a few spiritual mechanisms. Renewing of the mind, spiritual memorization, contemplative prayer, challenging thoughts using one's religious resources, and involvement in a religious community. I would also like to point to the ABCDE method developed by Albert Ellis. This was a model that was developed to identify and challenge negative thinking. The steps in the process are as follows. A. Activating the event. Describe the situation around the time the negative emotions began. B. What negative beliefs or expectations automatically went through your mind when you were in that situation? C. Consequent feelings and behavior. What painful feelings did these beliefs or expectations lead to? D. Dispute the beliefs and deal with the situation. Is there any evidence that those beliefs or expectations are not totally accurate or true? Even if the situation can't change, what evidence do you have that you could manage it? And E, effective new approach with religious beliefs. How can your view of God, the Bible, or spiritual wisdom challenge your automatic negative beliefs and your beliefs that you can't cope? This is a very fast, high-level overview, but as you can see, religious beliefs and behaviors can be integrated into the cognitive behavioral therapy approach. This integrative approach can help those with depression by challenging their emotionally disturbing thoughts and behaviors by using their own religious beliefs, practices, and resources. This can also be used as a method to introduce people to a religious approach brand new, as religion and spirituality is a known method that is effective in treating many mental illnesses. Thank you today, and God bless you.